Ms. Hall. Today we'll be going over your intake paperwork, as well as getting to know you a little bit better. As I mentioned before, I'll be going through some questions related to your PTSD symptoms, as well as asking some clarifying questions related to the experiences that you reported. We have a lot of effective PTSD treatments, and we want to make sure you get the best one that works for you. And as part of this, I'm going to be going through some questions related to your traumatic events. And you don't have to go through the details of the events per se, just generally what happened and what age you were when they happened. Does that make sense?
Yes, it does.
Okay. So on your intake paperwork, it says that your presenting concerns are increased anxiety as well as nightmares related to a recent assault.
Yeah. Things have been really hard for me lately.
Can you tell me what happened in the assault?
I got jumped by 3 guys when leaving the club with my friend. They beat the mess out of me. That was about 2 months ago.
That's terrible. Do you have any idea of why they attacked you?
It wasn't for the money or anything like that, if that's what you're thinking. My friend and I were leaving a gay club, and I think they were looking for someone to beat up. I guess I just fit the bill.
Fit the bill?
I'm trans.
Thank you for sharing that with me. I'm sorry they singled you out for that.
Have you ever even worked with a trans client?
Despite the understandable urge, try not to appear defensive. Sexual and gender minority clients may ask about a practitioner's relevant experience because of a history of discrimination by healthcare providers. Answer as honestly as possible and then assure them about the areas in which you do have expertise, such as the treatment of PTSD. Tell them clearly that you want them to help you understand their individual experiences as a trans man or woman and are willing to learn.
I have worked with LGBT individuals in the past. However, my specialty is in PTSD and not specific issues related to LGBT individuals. However, I don't want to make any assumptions about you or your experiences. Everyone comes from a unique history and background. So I hope you would be willing to educate me and help me understand how your experiences as a trans woman affected you, as well as how the trauma has affected you as well.
Yeah, I can do that.
Okay, great. Again, thank you for sharing your trans background and that traumatic experience with me. I think it would be pretty difficult to share both those experiences with someone new. So, you think they attacked you because you're trans?
I know they did.
Can you tell me more about what happened?
We were coming out of the club, and I think they were just looking for someone to mess with. I don't remember everything. It all happened so fast. There are pieces I don't remember. I felt pain. The next thing I knew, I was on the ground and I heard screaming and they were running away.
You must have been so scared.
Yeah. I just felt pain.
It's so terrifying, and I wonder, was there anything else that you remembered about this?
Well, when it was happening, I thought it would never stop. I blacked out. I thought I was dying. And then they took me to the hospital. And all I remember, it was fuzzy, was this police officer saying my dead name. And it seems like he chuckled or something.
Can you help me understand what you mean by your dead name?
In working with transgender individuals, some may refer to their given name as their dead name. Speaking about the client's given name, and more generally, their experiences before living in their affirmed gender, can be very stressful. To show respect for the client, we recommend not asking for the individual's dead name. Follow the client's lead and mirror their language about their gender identity and development.
That's the wrong gender and name assigned at birth on my license. It's super masculine, but the procedures I've had make me look a lot more feminine than the photo on my license. Anytime I have to use my license for a procedure or fill out a form with my legal name, it just feels terrible. Every time I'm forced to use them, I feel like I don't belong. And in that moment, when I'm in the back of an ambulance and I have to explain myself, that's when I want to disappear. Hearing my dead name was a reminder of a part of myself that I wish hadn't existed in the first place.
I see. And after going through that assault and with all the pain you're going through and not being able to think clearly, you're then forced to explain yourself to this policeman.
Yeah.
I hear how terrible this attack was on you. And there's no doubt that this was a traumatic experience that would lead you to having PTSD symptoms like the anxiety, the depression, and the nightmares you've been having. And you know, Sammy, I've been thinking, it seems as if your trans status is so tied into this traumatic experience. I wonder if there's any other experiences that have been life-threatening that have either been related to or independent of your trans status.
Trans clients often report trauma symptoms related to the discrimination they experienced based on their gender identity or presentation. Expect these symptoms. It is also important to assess the full range of potentially traumatic events, including general stressors like accidents, as well as identity-based discrimination or even victimization. It is important to assess the role of sexual orientation or gender identity in assessment of a clinical issue, including trauma exposure and PTSD.
Yes, I have.
Can you tell me a little bit more about those experiences?
I don't like to talk about it, especially the time when I was in middle school.
I get it, and you know, you don't have to go into complete detail, but it is important for me to know for your therapy.
Like I said, it was in middle school, and these kids at school were harassing me. They followed me around every day calling me a fag. One day, these two guys in gym class were shoving me into lockers, and they grabbed me between my legs, hands in my pants. I couldn't get them off of me. I felt violated. I felt so helpless and alone.
I'm so sorry you had to go through that, Sammy. And I want to let you know that what you experienced during that time in gym in middle school was sexual assault, and that's another experience that can create PTSD.
I just thought it was me.
You didn't do anything to cause that to happen. They had no right to violate you. Can you tell me more what happened?
Well, it probably lasted about 15 minutes, but it felt like hours, and no one came. There were noises in the gym, like talking. They got quiet, and then they ran away and left me there.
How did it end?
I got myself together, and I went home. My mom could tell something happened. I was a mess. That's when she pulled me out of school and decided to homeschool me.
It sounds like a good idea to pull you out of school to get you away from those guys.
Yeah, it was. But then I felt like a weirdo for being homeschooled.
I get it. And were there any other experiences you went through?
Well, I don't know if these count as traumas, but as a trans woman, I constantly have to deal with stares and harassment, like going to the restroom in public, which I try not to do. You get weird stares all the time. Like the other day, I had this woman at the mall give me a dirty look because I went into a family restroom and she's asking me why I felt the need to make her wait with her kid who had a dirty diaper. It just sucks that I'm forced to use a family restroom. And the anxiety that I feel over going to the bathroom every day is something that women never even have to consider. It's not fair. Just let us pee in peace, please. And I also feel like this is just something that people like me have to go through.
And you're right, it's so unfair. And it sounds like you've been discriminated against as a trans woman.
I I've even had people follow me into the bathroom to gender police me or to sneak a peek at my genitals. Why do they care so much? Why do they think that they have the right to know what's in between my legs? That's my own damn business.
Research documents significant psychological consequences of living with a socially stigmatized identity. One well-supported framework, the minority stress model, identified a few of the internal experiences. Some examples include passing, identity concealment, chronically expecting rejection, and internalized transphobia. These areas are important targets of assessment and intervention.
And I just want to put in a trauma perspective here. So far, you've described two distinct assaults that could certainly create PTSD symptoms, like the anxiety, the depression, the nightmares. But Sammy, I also want to let you know that certain forms of harassment, and certainly chronic harassment that you've been going through, can create PTSD symptoms too. And I want to let you know that I can help with this. And together we can process these trauma memories that you have so we can reduce those PTSD symptoms. How does that sound?
Seems a little impossible at this point, but I'm willing to try.
I'm glad you're willing to try. And unfortunately, I can't control the world out there, and I can't make people be fair, accepting, or understanding. But what I can do is help you through these PTSD symptoms.
I want a new normal.
I get it. And together with this treatment of processing your PTSD symptoms, we can find out together what a new normal might look and feel like for you.
That all sounds good. I just don't know if I'll ever get past all of this.
I understand why you may think that, especially with all that you've been through. But I can't say for sure what the new normal will look like or what treatment will look like at the end, but I think if we work together, taking it step by step, we can really create a good plan for you and your treatment to get you to where those PTSD symptoms don't get in the way of your life. How does that sound?
That sounds great. Thank you.
Thank you. So we talked today about how current everyday stares and comments really affect you, and I'm wondering if there's any other really bad experiences, like the bad experience at the gym, where you were hurt for being different.
Well, it seems like it happened all the time.
Is there any kind of event that really sticks out to you?
The only other really hard time in my life was when my parents decided to send me to a Pray Away the Gay camp. It was terrible.
Trans people will have other intersectional identities and experiences that are important to pay attention to. For example, many trans and sexual minority individuals have complicated relationships with religion. Symptoms of internalized transphobia may be compounded by these intersecting identities and experiences, which can cause significant distress. It is important for clinicians to assess for and be sensitive to these factors.
Yeah, tell me what happened.
My parents are fundamentalists through and through. They throw the Bible at anyone who's not Christian and are the most judgmental and intolerant people I know, especially my dad and my relatives on his side of the family. He would quote the Bible every day of my life. When I came out for the first time, he was the one that forced my mom to send me to the camp.
And that's so invalidating of you coming out to your parents for them just to send you away to camp and expect you to come back the way that they want you to be.
Well, there were prayer groups like 4 times a day at least. There was a Christian counselor that met with me one-on-one, and she said that God would want better for me. I wasn't allowed to present myself as feminine in any way. They made me dress like a stereotypical boy. It was like putting on a costume. I was so depressed at that camp. And it was at that time that I thought that maybe I would be better off dead. And at that time, I was seriously considering ending my own life.
That's significant and important. And I will go through the suicidal thoughts that you've had, but for now, I really want to go through what exactly happened in that camp and how did you handle it all?
Well, all I can remember was their harping on me in my face, telling me how bad I was and that God wanted me to be better, different. I cried a lot. After a while, I stopped getting out of bed. I felt so helpless. I felt like a fake. Then after some time, I think 3 days into the camp, I don't know where it came from, I ran away. The camp was in the woods, but I caught a ride into the city with some guy who took me to the ER. Luckily, the nurse was trans affirming and she called my mom and told her that whatever treatment they were trying was causing me to be suicidal. I think that woke my mom up. She took me home. I was about 3 months from graduating high school, so they let me live with my grandmother until I graduated. And then I moved, and I never turned back.
It seems like that's another really unsupportive and invalidating environment that you had to go through. And are these events coming back to you like in nightmares?
Actually, they have. They were gone for a while, but they've been coming back up since the attack.
And I want to let you know, Sammy, that what you're going through is really common. You found a way to bottle it up and stuff it away, and since you've gone through another traumatic event, it's almost as if it brought it back up again. Can you think of any other experiences that were stressful or traumatic?
I can't think of any more right now.
Okay. Well, I think you get the picture of today, and I want to let you know that these awful things that happened to you, they created these PTSD symptoms that can go away with proper treatment. And you've identified a lot that we can work on with today and throughout our time together. And if you remember anything else as we go along, please let me know, okay?
Okay.
And I know we just met today, but I really want to emphasize the strength and courage it took to get through all those situations you talked about. And most importantly, acknowledge the courage it took to seek treatments. And you still managed to get out okay, and you're still here today.
Validate, validate, validate. Normalize the individual's PTSD reactions and symptoms to the traumatic events. Help them understand how their symptoms are reactions to traumatic events.
It's really hard to see sometimes when you feel so misunderstood or judged, especially when no one comes to my aid.
I understand it can be really frustrating and invalidating. And next time we meet, we'll be going through and addressing your PTSD symptoms. I also want to thank you again for being so open discussing all these events with me, especially it being our first time meeting together and still trying to figure out what it's like to work together and what it feels like.
Thank you for creating a safe place for me to process.
You're welcome.